Much, Mr. Samuels. As you would have heard before, I am acting for the Chief Medical Officer, Dr. Hazel Laws, who is away on a much-needed vacation. I also know that she is listening and looking right now, so I just want to tell you to continue to enjoy yourself, and I'm looking forward to seeing you back on the 20th of this month. I've been keeping a record. I also want to say a big thank you to the persons who work behind the scenes to put this situation report together. I speak of Dr. Marissa Carty, Dr. Rafael Rosales, and Akila Moore. With the CMO being off and me having to be working with them, I understand now the magnitude of the work that they have to do to get this presentation ready for you. As of the 12th of October, the Federation had a total of 2,466 cases to date. In Nevis, 395, and in St. Kitts, 2,071. We have a total of 976 active cases. I'm happy to see that the active cases have fallen below the 1,000 mark for a few consecutive days now. Of these, 110 are in Nevis and 866 are in St. Kitts. We also have a total of 1,469 persons who have recovered, 282 in Nevis and 1,187 in St. Kitts. We currently have 10 persons who are hospitalized in the Federation of St. Kitts and Nevis, 2 in Nevis and 8 in St. Kitts. They are all stable and no one is on the ventilator. We have recorded 21 deaths. When I gave this presentation last week, this number was much lower than this, and I said that the deaths will continue to rise as long as people don't come forward and get the best protection against severe disease, hospitalization, and death, which is the vaccine. And I want again to appeal to persons to come forward so that next week when I come, that number would not be rising as it has been over the last several weeks. This next graph shows you the 2 waves that we have been through. The second part of the graph is showing you the second wave. You see that we had several peaks. I'm happy to announce that we appear to have troughed and we are beginning to see a downward trend in the number of positive cases. This next slide shows the percentage of cases by age group. And you can see the most common age group affected, those persons between the ages of 20 to 40. However, there is no age group that is immune, and we see that from the 0 to 9 years old, we have about 13.5% of persons down there being affected. And when we speak about getting vaccinated to protect yourself and to protect others, these persons in that low age group, they cannot be vaccinated, and they're dependent on you to go forward and get vaccinated so you can decrease your chance of getting infected, of transmitting the virus to these persons. And so we all have a moral duty to protect those who can't protect themselves. We also see that in the 10 to 19-year-old age group, we have about 15.9% of the cases occurring there, and we now have a vaccine, the Pfizer vaccine, that can be offered to persons between the ages of 12 and 17. It's offered to everyone over the age of 12, but for the first time over the last several weeks, we have a vaccine for our teenagers, and I want to encourage the parents again to take their teenagers out to be vaccinated. If we look at how things have progressed over the last week since I presented here a week ago, we registered a total of 172 new cases over that period. As it relates to the hospital admissions, we had 2 admissions and 2 discharges, and so the hospitalization basically stayed the same. The good news is that over this period we had 312 recoveries, and so that is significant, and I want to wish everyone who is fighting the disease now a speedy recovery. Unfortunately, over the past week we had 5 deaths, and the deaths continue to be mainly among the persons who are unvaccinated. So when we examine the 21 deaths that the Federation have recorded thus far, we had 18 in Nevis, 18 in St. Kitts and 3 in Nevis. And of these 21, only 3 were fully vaccinated. And the majority of these persons were not fully vaccinated and had comorbidities, meaning that they were suffering from diabetes, hypertension, kidney disease, heart disease, etc. And again, there is this misunderstanding about getting vaccinated and having a pre-existing condition. Some persons say because they have asthma, because they have heart disease, because they have kidney disease, they're not strong enough to take the vaccine. These are the persons who need to go out and get vaccinated, because if you have to fight that chronic illness with COVID-19, you may not survive. And even getting vaccinated, if you have if you have significant comorbidities, just getting mild COVID disease can push you over. And so the most important thing is for you to come forward and get vaccinated. Because when we look at the persons who are becoming infected, next slide, we see that the majority of the cases, they are occurring among the persons who are not vaccinated. Now, it's important to note here that we said that if you are vaccinated, you have significant protection against getting COVID-19, but you are not exempted. And so persons who are vaccinated can still get infected. However, they tend to be infectious for a much shorter period of time. The majority of them may be asymptomatic or have mild disease, because the vaccine protects you against severe disease, hospitalization, and death. And so as we move forward and we have a greater proportion of the population vaccinated, and the virus continues to spread, we will still see vaccinated persons getting COVID-19. But with most of us being vaccinated, we can release the stranglehold that COVID-19 has on us, and this can become just a mild form of the disease that you will have and don't even know. And so we want to encourage persons to come forward and get vaccinated. Our vaccination program continues, and we continue to see success with the vaccination program. As of yesterday, we had 69.6% of the adults in the population who were fully vaccinated. And I'm just dying to see, or anxious to see, us get to the 70% mark. We also have 76.9% of the adults who have received one shot. What is good about this vaccination program is almost every single one who came for their first shot, they're coming back for their second shot. And so wherever on the thermometer we have seen the first shot, the second shot crosses there. And so I know in the future we would see 76.9% of the population fully vaccinated. I know in the future we will get to the 80% mark that we were aiming for in December. And at the rate at which we are going, we are on trajectory to get to 80% by December. The second thermometer shows the vaccination rate among our children, and I'm happy to see that this is moving along also. To date, we have 5.6% of the children between the ages of 12 to 17 who are fully vaccinated, and 10.1% with one shot. I want to make an appeal again to the parents of these teenagers. The only how we can keep our schools open is if you go forward and get vaccinated. Now, a couple of weeks ago, when the Prime Minister had his conference here, he said that he wanted us to get to 80% by December so that we can see a further relaxing of some of the restrictions. And getting to 80% might sound like it's a daunting task, but I want to simplify it. So we have a total of 26,430 adults who are over the age of 18. 80% of the population over the age of 18. That number comes to 26,430. And so that is the number we need to get to reach to 80%. Where we are now, we currently have 25,405 adults who have had one shot. And so we need a further 1,025 persons vaccinated to get to the 80%. And what this means is if the persons who are vaccinated form themselves into groups of 25, each group of 25 only needs to bring one person in who is not vaccinated to be vaccinated, and we can be there tomorrow. And so you can see it is within our reach. And so I want to ask you, if you have done the right thing by getting vaccinated, you form yourself into groups of 25, go out and bring just one person. And we will get those 1,025 covered, and we'll be at 80% vaccinated. So it is within our grasp. You heard about the new SROs, and some persons appear to have been confused by what it said. Next slide. I'm not going to read through the jargon that is placed in the SRO, only to tell you that this is simply telling you that, number one, you need to have a negative RT-PCR test to enter the Federation, which everyone knew before, within 72 hours of getting here. And once you are here, you should be tested within 24 hours of arriving, and once you get a negative test, you can be released from quarantine. So what this means then is if you get to your hotel and you're tested, and you can have a result back in 4 or 5 hours, you will be out of quarantine. So that's basically what the rule is stating. I want to tell the citizens and residents that the government continues to work to keep you safe. We know the best protection is by the vaccine, and we continue to seek to acquire more vaccines, and so we should be having a shipment soon of some more Pfizer vaccines, and we are also working on getting extra doses of AstraZeneca. But for now, we have more than sufficient supply, but we are making sure that we will never be short of vaccines. And so I want everyone to continue to come out to use this precious commodity. We have started the education program in the schools. We started first last week by having a virtual meeting with the top brass in the education sector and every single headmaster, mistress in the primary and secondary schools to explain the vaccine and the vaccine program. And we have now started sessions with the parents. We're having PTA meetings to speak to parents about the vaccines. We have done with the Charles E. Middle School, the Bastia High School, and a few other schools in the rural areas. We'll continue this throughout this week. And the schools will be given appointments to go to the clinic so that they can have the vaccines done. We are hoping to have at least 80% of our high school children vaccinated so that we can continue to have in-class learning, because it's very difficult for children to get ahead with the virtual learning. I've said before that I am happy that I was not a school child within this period of time, because I could not imagine having to be sitting behind a computer trying to understand physics, maths, and chemistry without having a teacher right in front of me. And so we need to make sure that our children get back into in-class learning, and the only how that can happen is if they are protected, and the best protection is through vaccination. You heard about the field hospital. I'm not going to say much more about this other than to say that the capacity, the bed capacity of the Joseph M. France Hospital, which is our main hospital, is 164. And we took 20 of those beds and dedicated them to COVID patients. And so our capacity was decreased. And I was happy to hear that the field hospital in the first instance will be deployed at the Joseph M. France Hospital, adding an extra 40 beds to our capacity. And that will help us in our fight against COVID-19 and also the other conditions that we continue to fight there. A number of persons will be happy to know that the task force, we were actively engaged in discussions with plans for Carnival. Last year, December, there was a virtual Carnival where there was no in-person events. And at that time, we had 0 persons who were vaccinated, and we had a virtual event. And so we believe that the minimum we can have is a virtual event, and with the significant vaccination coverage that we have, there is latitude for discussion to see how we can have other events, and I'm pretty certain that you'll be hearing more about this, and so keep your hopes up. Last week, I spoke about the antigen tests and the fact that the World Health Organization still recommends that the gold standard is the RT-PCR test, but as the science has developed, the antigen tests are becoming more sensitive and specific, and they're finding a greater use in the management of the COVID-19 patient. This is not to be confused with the rapid antibody test that right here at this podium, Minister Phipps at the time, who was the Minister of Health, said that we would not use, and there is no country I know that's using the rapid antibody test in terms of diagnosing persons with COVID-19 disease, because if you were to have a rapid antibody test, you would not be able to tell the difference between somebody who is vaccinated or somebody who is infected, because the antibodies will test positive. We're talking about a different test, which is the rapid antigen test. And as I said, it is finding a greater role in the management of patients with COVID. Next slide. The sample is taken from the nose or the mouth, and the results are obtained very quickly within about 15 to 30 minutes. And antigen tests that have a sensitivity greater than 80% and a specificity greater than 97% compared to the RT-PCR tests, they are finding greater use in the management because, number one, you get the results very quickly, and two, you don't require any significant laboratory infrastructure to have this set up. The World Health Organization gives guidance on how these can be used, how, when, and where. Next slide. And the 4 scenarios under which these can be used is for case finding, contact tracing, investigating outbreaks, and monitoring. Who is controlling it? Yes, and monitoring. Okay, and we believe that we may soon be able to use the antigen tests in some of these conditions, because if, for example, there was an outbreak in the prison or there was an outbreak in a nursing home, instead of in the past where you'd have had to do an RT-PCR test on 100 inmates, you can do the rapid antigen test on the 100 inmates and get your results back in a very short space of time and determine what measures you will take. Or if there was an suspected outbreak in a school, you can test a class right away, get the information, determine whether or not you need to take out 1 or 2 kids, and the classes can continue. And so the recommendation that the Ministry of Health is considering, and I'm pretty certain that this will be put before the Cabinet for them to make the final decision, is in the use for case finding, outbreak investigation, and monitoring trends. We will continue to use the RT-PCR test for the contact tracing for the time being, and we will still use the RT-PCR test, which is the gold standard, to confirm any positives that we have. We will only be recommending antigen tests that are approved by the World Health Organization and the FDA. And we know that there are some countries, when people are leaving, they accept the rapid antigen tests for the outgoing passenger. And so there's absolutely no reason why, going forward, we would need to insist on somebody having an RT-PCR test that would take about 3 to 4 hours for them to get the results back to leave, when the country that they're going to will only accept, an antigen test. And so these are things that are under consideration. If this is passed, however, these tests will only be performed, that is, a sampling by a trained professional, and they will only be recognized when they are run at our local certified labs. Next slide. I was speaking to a gentleman just yesterday, and he told me, why don't you, when you are here, give the people one reason why they should go forward and get vaccinated? And so I decided I would listen to him, and instead of giving 1, I give 10. Okay, and so number 1, the vaccine is free. When I say there's a cost associated with the vaccine, and the government has invested quite a lot of money to get the vaccines here to you, but there is no barrier to you getting the vaccination. You can walk into any clinic 7 days a week during the scheduled clinic hours and get vaccinated, and so it's important for you to take advantage of this. The vaccines also, we know they have a high efficacy. The AstraZeneca is about 84.3, the Pfizer about 95, and so it's important for you to make sure that you take this protective cloak and cover yourself with it. When I spoke about the 5 deaths that we had over the last week, if Kwame Henry came here and said that these 5 deaths were 5 persons who were speeding on a motorbike without a helmet, the entire population would say, why don't they stop speeding? Why don't they wear a helmet? Well, if we had 5 deaths, mainly in persons who were unvaccinated, we should be asking, why don't they take the vaccine that has been proven to be effective? Okay, and so we know that the vaccine gives you a best chance at survival, and so a fourth reason is that it saves lives. And it is safe, okay, because these have gone through significant rigorous testing from animal trials to phase 1 to 3 trials, and billions of doses have been administered globally already without any significant side effects. And so we need to make sure that we step forward and take it. You not only protect yourself, but you protect those around you, especially the vulnerable. And so there are a lot of persons who have children at home who cannot be vaccinated. You have elderly persons who, if they get infected, they can succumb to COVID-19. And so you're doing this not just for yourself, but for those persons around you. You also need to do it to protect the healthcare system. We saw around the globe when countries were going through their waves, how their healthcare system was being overwhelmed. We saw just a week or two ago when our testing system got overwhelmed and people were complaining that they were in quarantine for an extended period of time because we had a bottleneck with the testing. You can imagine if that bottleneck was at the hospital where persons were getting sick and we didn't have enough beds. And so by you protecting yourself from severe disease, by you protecting yourself from being hospitalized, you help to protect our healthcare system. We keep hearing people speaking about, the entertainment sector not making any money, the cruise ships are not coming. And so there are a number of things that are affected adversely by the stranglehold that COVID-19 has on us. And if more of us come out and get vaccinated, we can release the stranglehold and get back the economic activity that we had prior to COVID-19. Another important reason is to protect future generations. There are persons before us who decided that they were going to roll up their sleeves without all the information that you have here now and got vaccinated against polio and smallpox and measles and mumps so that these diseases were eradicated, and we did not have to worry about this. And so in protecting yourself now, we can make sure that we can eradicate COVID-19 so generations to come will not have to be dealing with this or the variants that can develop if it continues to spread. Another reason why you should get vaccinated is to help stop the spread of fake news, because when you go forward and people see you get vaccinated, you're basically sending a strong message that I believe in science, I believe in the evidence that tells me that the vaccine is safe and effective, and I believe that this vaccine will save my life. And for all of us who complain about how things are now, it is the quickest way for us to get back to normal. So those who want carnival, those who want to go back to church, go back to in-class learning in school, whatever you had before COVID-19, by us getting vaccinated, that's the quickest way for us to get back there. There is good news on the horizon as it relates to the treatment of COVID-19. There's a drug, molnupiravir, that is being developed by Merck, and they have applied for emergency use authorization from the FDA. It's the first antiviral pill against COVID-19, and it represents a major milestone in the fight against COVID-19 because it is very convenient. It's just a capsule that you will swallow. It is inexpensive compared to the antibody cocktail that President Trump had when he was sick, and it will be readily available because you can actually take it at home. It's just 4 capsules that are taken twice a day for 5 days, and it has been proven to halve the hospitalization and deaths. In the clinical trials, it was used in unvaccinated adults who had comorbidities, diabetes, hypertension, etc., when they took it within 5 days when they were infectious. As a matter of fact, the clinical trials were stopped because it was being so effective, and that's why they're applying for emergency use authorization. So if this is approved, this will be a major step in the fight against COVID-19 and putting COVID-19 behind us. Unfortunately, it would not be given to pregnant women because of the mutations and birth defects that might occur because of this. I want to, in my penultimate slide, encourage persons again to go out and get vaccinated, to wear a mask, to maintain your hand hygiene, to social distance. And if you're ill, you need to stay home. And in my last slide, While we are fighting COVID-19, there are a number of persons who are fighting other diseases. This month is Breast Cancer Awareness Month. This Friday coming is Mammogram Day, and I want to tell those persons who are fighting COVID-19 and fighting the brave fight against breast cancer to let them know that our thoughts and prayers are with us, and that's one of the reasons why I'm wearing my pink tie today in support of those persons who are fighting breast cancer. Stay strong. I thank you.